Good afternoon, everyone. Thank you for taking the time to join us virtually today for our July 2022 ACES quarterly event. Today, we have a presentation that is titled, "What We Have Here is a Failure of Mental Health Care," that will be presented by our guest speaker, Carolyn Heatherwick-Goza. So here's a look at today's agenda. We will have an introduction of our guest speaker, Carolyn, who will then present on topics including mental illness statistics, Washington State's mental health law for youth 13 years and older. She will talk about a grab and go resource, how to communicate directions, how to manage behavior. She'll go over an iceberg analogy, share available resources, and read a poem titled "Welcome to Holland." And then we will finish up with a group sharing of resources and a question and answer time. Among her many experiences, including being an educator, a subject matter expert, a caretaker, a full-time mother, supervisor, and community volunteer, Carolyn is a member of the National Alliance on Mental Illness, NAMI, as well as the only certified instructor in Snohomish County of NAMI's new national curriculum, Basics, which is for parents of mentally ill children ages 18 and younger. Carolyn has also started a monthly parent support group. Thank you, Carolyn, for being here today to present on this topic for us. I'll go ahead and hand it over to you.
Thank you. It's a wide topic, and so I will try to condense it as much as possible. What we present in Basics, which is the name of the program, it's an evidence-based program written by Dr. Gary Brister at National NAMI, is a 6 weeks program, and my husband and I have done it for 17 years and 2 and 3 times a year. And now we're looking for other people to do this evidence-based program. So if you feel the urge, please let me know. Mental illness, you do not ask what illness your youth has, but what illness has your child. You can't know what no one has told you. This is what we hear so often from our parents. Well, I wish I had known this 3 years ago or whatever. And it's you can't know what no one has told you. Let's look at some numbers. More than 13.7 million, or 20%, of our nation's children and adolescents have a diagnosable mental health or autistic condition. 6.9, or 13%, of the children under the age of 18 have a brain issue that causes a serious impairment. And one of the new things that we've gotten with Basics is we have 4 cute little films or cartoons that explain these illnesses and what causes them that have been very effective. About 80% of these children and adolescents fail to receive any treatment or services. This is the frightening part because I just read the report for House Bill 1590, and it has gotten so much worse since the pandemic. So we have got to get some more help. A very recent study shows that slightly more than 70% of the juvenile detention population has at least one psychiatric diagnosis, And for that matter, in our jail also, we have that, a similar number. More than 50% of the students living with the brain health issues over the age of 14 drop out of school. More than 50% of serious mental health or autistic issues occur by puberty. This is when the brain does one of its major changes. And when a parent calls me with an issue, I'll say, what is the age of your child? And 9 times out of 10, it's going to be with puberty, including my daughter. She had no issues until she hit puberty. Studies in the emotional disturbance category of special education fail more courses, earn lower grade point averages, miss more school days, and are retained more than students in any other disability category. Now, I do want to put in a caveat here because there are 13 categories of special ed in the federal government, and in one of the categories is emotionally behavioral disturbed. And if we can get more of our children in the special IEP classes, including my granddaughter who just graduated in the top 10, we can get them special help in school and hopefully keep them in school. Now, Washington State is very unique. In looking for residential treatment centers for some of my parents, I call places all over the nation and they say, oh, yes, you're the state that's 13. No other state at the age of 13 declares a child an adult so that they can refuse medication, they can refuse being hospitalized, and that's something my parents say, well, what can we do to change that? One of the things we suggest for our parents, if you look at Disability Rights Washington and pull up their website, there is a form or forms. There are several pages of instruction, but if you can take your child to McDonald's or wherever they want to go, and get them to sign this mental health directive, has to have 2 witnesses that are not related or not professionals. But if you can get them to do that, then that will then allow the parents to jump over this disability restriction of the age of 13. Rearing special youth takes commitment, patience, and perseverance, in addition to Dr. Brister's wonderful curriculum of NAMI basics. Severely emotionally disturbed special education caregivers must understand that they need to be assertive, not aggressive, with the schools. When my parents are going into an IEP meeting about a special education for their child, I preach that to them because I want them first to listen what the school has to say, and then we'll come back and get the parents' wishes, and see if we can't somehow meet in the middle. One person does not have the right to control, threaten, an entire family get help. This statement is in red for a reason. Parents, you have, when you're seeing the behavior of your child, that something is just not right. They're not like your other children or ones that other friends or relatives have. And you don't have to wait until they hit school or till they have mental health care. You can make a contact to a mental health provider and get your child started as soon as possible, even the little ones. My children started therapy from the age of 2. They did play therapy, and it really helped. We didn't have to wait until they were already in trouble with the law or other things like that. Now, we're talking about the grab and go. It is something that we give all of our parents that take basics um, for them. And this is uh, where they keep all the records, where they have all the medications the child is taking, the dosage, what the child's reaction is to the medication. A parent teacher calls from school or emails, put it in your grab and go. And you also need like a picture of less than a year old. Um, my son ran away from a psychiatric facility in Austin, and I talked to the police department and I said, "Did you describe my child?" And I said, "Would you please tell me what you said?" And what they didn't have any pictures, and what they told the police was so out of bounds. And so he was missing for a whole month, a whole week before we were able to get him back into the facility. The grab and go is a journal that everybody, and you can download it there from NAMI, Wyoming, record keeping. You don't have to have it just for children. If you have an elderly person living in your home, or you yourself have special needs, that is life-saving, because you can't keep up with all your meds, or I can't, unless they're written down and the dosage and all. And it's wonderful to have it all in one place. And if our parents ever have to call 911, many of them just hand the grab and go to the ambulance driver. And so because the ambulance gets to the hospital quicker than the parents can. And so this is very important. Likewise, look online at Smart 911. It is where you can put in all their meds, what their problems are, what things trigger them, what things help them. And you know, the only people that can get this information are the law. And we had heard that it was nationwide, but we didn't have any evidence until one of our parents had to send their child to live with her sister in Missouri. And she had a breakdown in Missouri, and they called 911, and 911 said, "Oh, this is wonderful. We've got everything we need right here." And so again, not just for the youth, but elderly. It even asks about any animals that are in the house, where they sleep and things of that nature. So along with the written form, Smart 911 is a great asset. You are always the best advocate for your youth. You know them best, love them the most, and you are the CEO of the team caring for them. This is something we preach to our classes all the time. The parents are the ones that know their children best. And so you get the credit, and the professionals work for you. But sometimes we have to remind them of that. To be effective, you must be prepared. Having your own records, your grab and go, means that you always have information that might be needed at your fingertips rather than waiting for the agency to locate them. An example is my last name for 40 years was Heatherwick. And invariably, if I went into the doctor, they were looking for my records under Wick and thought my first name was Heather, and they couldn't ever find my records. And so until we got it straightened out, because I had a copy of them myself. And this is where you can get a copy of your grab and go. And you see that it goes through personal, the medical part, and also school if your child is on an IEP. And you never, ever, ever give the original copies. Make copies of it. Keep the original safe, like the birth certificate, like IEPs, like insurance cards. But if you have your own copy, you don't have the trouble of the provider not being able to find the records. And if your children are like mine, they were not the best waiters. In other words, they didn't want to wait until they could find the information. So always make a photocopy for it. And then at the end of the grab and go, there's a crisis plan that the parents work together on, making sure they provide for other children in the family if they have to go to the hospital with one of them. And also then after the episode is over and the youth is back home, there's a page for a relapse plan where you have him help you come up with, well, what signs do you think we need to be looking for that would tell us we would need to call 911 again, or that you would need to go to the hospital? Language is extremely important with these mental health children and adolescents and young adults. The difference between getting mental health care and going to detention is how strong you can be letting 911 know you are not, he is not trying to hurt anyone unless it's true. So if you call for crisis line or 911, be sure to separate him from other family members and leave the house if the raging child can be safely left in the house. Make sure you're always near the doorway. In other words, if you're having a conversation and he is in a rage, make sure that you're the one closest to the door. And then if he starts getting totally out of control with violence, you can leave the house, lock the door, go to your car, call 911. I get so many calls from the cars. And then the police will come in and de-escalate him. Make sure that you're always near that doorway so that they do not feel trapped. And the next day, make sure you contact the school office, his personal therapist or psychologist about what happened, and make sure you record it in the grab and go so that it's in his record. When your loved one is stressed and upset, you want them to know that you care before they care what you know. And as part of one of the exercises in basics is where we make statements, practicing using I statements. I don't like the way you leave your Legos all over your room. And instead of saying, you left your Legos all over the room, which is accusatory, and they react to that. Life is what we make it, and the life of our youth is what we help them to have. So please care enough to send the best message. The differences we have seen in parents as we have taught all of these classes, and we've had some very, very serious issues after they realize that they are not the only ones going through this. In communicating directions to them, you cannot control what the youth says or perceives you to say. And lots of times it's language you don't particularly want to hear when they are angry. What you can control is the type, quantity, and tone of what you say. I like the way you're calming down, Brennan. Say what you mean what you say, and then be quiet. Many of the parents say they just talk all the time. I don't have 1 minute where they're not talking and asking questions. Well, say what you mean what you say, and then just be quiet while they process what you say. It takes a while. And it's interesting, isn't it, that the words silent and listen have the same letters. Is that a clue? We need to listen more. In communicating the directions to a youth, again, the various brain disorders impair the abilities of our children to process what is said to them. There are concentration problems. They cannot handle more than one oral thought at a time as it gets clouded by emotions and distractions. Parents make signs in the bathroom all the time, cut out pictures from magazines and all about brushing their teeth, taking a shower, because they just do not process that much when their brain is jumping all over the place. Families living with special needs, children and youth, have extra need for good communication skills. make I statements rather than you, as I was just explaining. You would say,
Sorry to pause. If you're unmuted right now, can you please mute yourself? If you're on the call and you're unmuted, please mute yourself. Thank you.
thank you. And an example is, I feel disappointed when you do not pick up your Legos, instead of you didn't pick up your Legos. One is really demanding, and that makes them so mad with things like Legos and little cars and things like that. My grandson, whom we adopted as an infant, and who had mental health issues, he had his own dustpan. And when it came time to pick up his Legos or his cars or the things he was playing with, he used the dustpan. He filled it with the toys and put them away, and it made it much easier and quicker for him. Get the youth's attention. Go to the child and speak the youth's name. And if they're younger, get down to their level. Get rid of other noisemakers like video games, TVs, radios, iPhones, whatever. That stimuli is just too much for them. You give them clear directions and give them simple directions. Make sure that the child understands what you have said. You can even have them repeat it back to you so that they hear it again. And we will talk about some other ways to help them deal with auditory directions as we move through this. We are now on communicating the directions, as I just mentioned, and you want to agree and never argue. You want to divert and never reason. Distract, never shame. Reassure, never lecture. I can tell you, if you start lecturing, they're cutting out, their ears are shut after you say the first 2 or 3 words. Reminisce with the older ones rather than say remember, and repeat and never say I told you so. Do what they can do, never say you can't. Ask, never demand. Encourage, never condescend. And reinforce, never force. I used some of these techniques when I was teaching special ed in California. I was in the resource room and I had the little guys. They were just my precious ones. And they could do something if I was standing right beside them. And so I had one in particular, and I always froze because we were right next to the air conditioner. I took off my blazer and put it on the chair next to the student. And I said, okay, now you can pretend that Mrs. Heatherwick is still right beside you so you can finish your math sheet. And it worked for a little while, and I would come back and check on him. He was such a sweetheart. I love my children. You want to catch them being good. In the South, I heard my mother say so many times, You can catch more flies with sugar than vinegar. So if you speak and ask them to do something in a kind voice, it's going to go over much better. Likewise, if you are dealing with the school administrators, I always try to teach my parents, the first thing you want to do is listen to what the school wants to present. And then you can then have a talk. So you need to use sugar on anyone to get the issues solved for your child. And I connect added on here 30 ways that you can say a good job. If you need to have information. But what we want you to do is be specific and sincere, because the youth can hear teacher or sarcasm no matter what you say. Their feelings are the most important thing to them. And if you just say, "That's good, Johnny," his mind fleetingly thinks, "Right, now I can get out of my seat." So it is much more effective with special needs youths and adolescents to say, "Good walking, Sue. Good following directions on your math sheet, Bill. You are listening well, Ella." Or, "I like the way you're waiting your turn so politely, Brennan." So the next page is just use them lagniappe if you're from New Orleans. It's ways that you can say they're doing a good job rather than just good or that's nice. Then behavior management. And like I said, we adopted our grandson as an infant. And this even worked for him when he was 2. You ask the child calmly and politely to do something. And then remind them, wait 5 minutes. If it's not done, tell the child they have to do it now, whatever their name. And the consequence is after 5 minutes, you give an immediate timeout or brief consequence. After the timeout, ask the child what they did and to get the timeout. And if they cannot remember, they have to start ARCS all over again. My grandson had to be hospitalized starting at age 3, about every 6 months. And they had a masking tape square for him that he had to sit crisscross applesauce in the square and sing his ABCs to on when he had gotten out of control. To do that, that meant they had to, that breaks the thought process that was in his brain. And it worked so well. They had it so planned, but bless his heart, he had so many issues. He had to stay in that square quite a bit. So with behavior management tips, you want structure, consistency, firmness, reasonable choices to avoid power struggles, and pick your battles. There are several things that he's not doing well or doing incorrectly. pick the one that is the most dangerous and the most important to work with, because violence can never be tolerated. Love acts. Acting to keep yourself clear of danger is the highest form of self-care. We are really saying we have no intention of letting brain illnesses rob us of our life. And if the danger looms, we are ready to separate ourselves from the threat. We have had some very serious youth and some that were strangling the parents and things of this nature. These we really had to use over and over again. You are the model and you are the parent. And again, you can start getting help for them as soon as possible. You don't have to wait for someone to tell you to get medication or go to a therapist. All right. So the suggested ways to triage those with mental health issues are you try to isolate them, as I said, get rid of all the noise. It bothers me. I would, and if they're having a breakdown and screaming, and my son liked to break windows, the way to do it is, and then compliment them. I like the way that you shut off the video game so that you could listen. And please try to approach calmly and softly. Remember, they have no social skills, so be aware of their bubble space. They may not want to be touched or cuddled, and I can pretty well guarantee you they do not. We are still, you must use short, simple directions and repeat as needed. They are probably distractible as you give directions, so you may need to repeat it. First, try to get them to look at you. Ask what is bothering them right now. When they respond well to your directions, say, "Good, following directions. I like the way you are calming down." If the law is involved, the professionals should ask about medications that are helping them and ask why do they think the law of police are there. And the police officers usually say, and we got this information directly from the police, would you feel safer if X were beside you rather than be alone? Ask the professionals that are there to talk slower so you can hear what is important to them and they can hear what is important to them. Before the law comes, you always need to be nearest to the exit, as I was saying before, so that you do not feel entrapped, or they will act like an animal in that situation, and you can safely exit if they start to attack. And this, I don't think, and in fact, I know my son was not the only one. He had bipolar and was in the hospital for many years. But no matter when he came to our house, he had not eaten. I would say, "When was the last time you ate?" and usually, well, 2 days ago or whatever. And if they're hungry, their brain is not working right. So ask them if they're hungry. Ask them when was the last time they slept. This is when your parenting skills go in, start working, and make sure that they have eaten and they have slept, because otherwise they're not going to pay that much attention to what you're saying. On a different page. Use language describing a positive outcome. Do not say pay attention. Instead say I do not I can't talk when you're talking. So when you listen, I will explain what is going to happen. If they have mental health, if you have a mental health professional coming or you're taking them to get help, this needs to be explained to the person with a mental health issue and family members. But don't forget your grab and go, because that has all the important information about the medications and when they've had blow ups. One of my parents came into support group one day just crying, and she said Jefferson just threw his whole plate of spaghetti against the wall. Yep, they will do that, but this was the first time she had seen that. Treat people as if they were what they should be, and you help them become what they are capable of becoming. Okay, this is my favorite. This is out of a book. And I don't know if they're going to be able to see my face and this on the screen or not. But I just need to point to some things. I think that's gonna work better. If you think of mental health issues, especially ADHD and ADD, these are the catch diagnoses now that we're hearing. Everybody has ADHD. I've been in special ed over 60 years, and I was, when I first started, it was the days that they couldn't read because they didn't crawl was the thing. And we had so many parents and so many professionals that were going that route of trying to get their kiddos to crawl. And now we know so much more. But with ADHD, the common diagnosis right now, it's like an iceberg. 1/8 of an iceberg, the top, is out of the water, and that's the part we see with their behaviors. We see the and have their, I can't read what I said, their hyperactivity. We see their inattention, and also their what does that say? And so impulsivity, yeah, great. But that's what you see, and what the first things the teachers see when they come in the room. But look what's under the water. Okay, 1/8 is above the water, 7/8 is below the water. And that 7/8 is very important, because that's the other things that are going on. The neurotransmitters, and when you take basics, you will learn all these words. Deficits impact the behavior. This is the neurotransmitters in the brain. They have weak executive functioning. That means for them to process things and act on it is very obscure and has they have impaired sense of time. They'll say they'll be gone for 15 minutes down to their friends, and 3 hours later you're looking for them. And sleep disturbance. My son did not sleep all night until he was 5. And by then we had his sister. Sleep disturbance is so common. And overall, in all the things that are under the water, there is a 3-year delay in brain maturation. Many of my parents will say, well, he plays with his younger sisters, or, he'll play with the neighbors' younger kiddos, but he won't play with anybody his own age. And that's right. He is impacted. He's 3 years behind in his maturation. And it's not easily learned with rewards and punishment. So there's no use confining him to his room for 10 minutes when it's not going to have any significance to him, and he's going to turn around and do the same thing again. They have low frustration tolerance, and they have serious learning problems. These are the ones we want to catch for special ed. And part of my credentials are I am a certified educational diagnostician. 38 states recognize certified educational diagnosticians. We were the ones that in Texas went out and did all of the individual intelligence tests, individual performance tests, neurological screen. And then if we saw something significant, then the psychologist would go out. But Washington State does not recognize educational diagnosticians. The psychologists, it takes the educational diagnosticians could take up take the time, and then that freed up the time for the psychologist to then do counseling with the parents and the students. It's something we really want to try to work on in Washington State. All right, with special ed, you don't want me to talk all day. I could do that because that's where near and dear to my heart. And like I said, I'm a certified educational diagnostician. I started out in education because my aunt, who always wore a pinky ring, and this, even though she was born in 1900, this literally is her ring. And I wear it all the time. She was the director of special ed in the Jacksonville, Florida schools. And I didn't know I was emulating Aunt Thelma, but mother and my cousins and my brother, they was, okay, Aunt Thelma, so I guess I was like her a lot. I loved her dearly. Um, and with where is that? Want to talk about the special ed. We have two things where you can get extra help for your children. And that is 504 and special ed. Yeah, I don't know where it there. And you can get further information by going on the OSPI, which is the Office of Superintendent of Public Instruction, Washington, and find out about them. But schools up here tend to be so reluctant to put youth on individualized educational plans. And so I'm going to have to condense this really quickly because with an individual educational plan, there are 13 categories that are listed in the WAC, Washington Administrative, and one of the categories is emotional behavioral disorders. And this is where all the anxiety, and I just read the information last night on this House Bill 1590, that if we had um, um, people that can get on an IEP, the disability category could be emotional behavioral disorder. And my granddaughter went through school and graduated in the top 10% on an individualized educational plan under the category of emotional behavioral disturbance. And like I said, you get the information from the OSPI. NAMI also, you take our basics and our support group, and we will give you lots of information about that. We have a monthly parent support group in Everett. There are some that are on Zoom, but that was not in my thought process, creating the individual, those that had suffered through the pandemic. They needed the face-to-face friends again. And so I started up our monthly parent support group that we've been doing for 17 years, and where it's the first Tuesday of every month. And no, it's not 6 weeks, it's just come when you can. And parents find out they can find friends there, people that are going through the same thing they are. And we talked about the disability rights of Washington as far as getting information so that they're not you get them to sign that, and you have some control over your child. And now it is live, the nationwide 988 suicide and crisis lifeline. And so that would be a great place to, if you need help, to go. There is the flyer about our basics class. Now, this is the 6-week one, the one she just went back. The parent support group is the first Tuesday of every month. Everything that we do is at First Presbyterian Church. It's right across from the courthouse. It's that 125-year-old church, and since we're members of that, we get to use it free. And then the other one was the our basics class. You do have to call and get information about signing up for that, because we need to make sure that there is airtime for everybody taking that class. And that's where I met Miss Sue in our basics class. Like I said, my husband and I have been doing it for 17 years, and he's had some health issues now, and so we've got to get some more teachers trained. And the training now is on Zoom. So if you're interested, please get in touch with me. Thank you so much for your attention, and yes, the special education information and how to get help is, as we talked about, is on the OSPI page, and that's where the difference between a 504 and an IEP. When you call, make sure you let people know it's a mental health breakdown, so your child can get help, not go be penalized for it. Yes, I want to read the Holland. This is how we start our basics class, because we're trying to get people to come to the grief of their accepting their child that has special issues. And it's called Welcome to Holland. I am often asked to describe the experience of rearing a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. And it's like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans, the Colosseum, the Michelangelo David, the gondolas in Venice, and you may even learn some handy phrases in Italian. That is all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes in and says, "Welcome to Holland." Holland? See, what do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life I've dreamed of going to Italy. And but there's been a change in the flight plan. They landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. I lost my page. It's just a different place. So you go out and you buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people who you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy, But after you've been there for a while, you catch your breath. You look around and you begin to notice that Holland has windmills. Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they had there. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever go away, because the loss of that dream is a very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. We go through the grief, and for me, my children are adopted. And this really hit home to me because we waited 6 years to get our first son. And every Christmas we get letters from all our relatives and all the things their children are doing and graduating and marrying and everything else. And yet our children were not. And so we had all of that to deal with. And so Holland really meant something. And the last thing, and I'll let everybody go, is at the end of our class, we give every one of our students what I call my Serenity Stone. I took grief classes for a while after I lost my husband and my baby. And we got something similar. So I wrote this poem, and it's called Serenity Stone. Living with a mentally ill child or adolescent may be one of life's greatest challenges. As a stone erupts from nature in a volcano, so too does mental illness. It can strike with unimagined ferocity, ripping through a family like molten lava. It allows no preparation. It hits quickly and leaves utter devastation and confusion. Please take a moment to unwrap this stone. Hold it in the palm of your hand and feel its smooth and calming effects. And we even have our daddies doing that. Allow your body to feel this sense of peace and serenity. Then put it in your pocket and carry it with you always. It is meant to help you through the difficult times. When you find yourself overwhelmed, let it remind you to care for your own self and remember what you have learned. You didn't cause it. You can't easily control it. You can't cure it. You must learn to cope with it. Quote from Dr. David Karp. So are we gonna take some?
Yeah, we're gonna take some questions.
Okay,
And I have a few to start us out. The first question is it appropriate for families who have a child with no diagnosis yet and are on a wait list for services to attend your monthly support group?
please, that's what we're for. Many people who come, or most people who come to our support groups, and our basics have not yet taken the step to get their child officially diagnosed. And so when they then come, are conversing with other parents, they then find out, oh yeah, that's what mine's doing too. Oh, oh, and do you have anybody in mind that I can go to? And so there's such a sharing of of camaraderie, and we really, really missed it during the pandemic. Even though we had a remote one, it
Mhm.
just didn't feel the same.
That's wonderful that those folks are welcome.
Yes,
Such a difficult time not having a diagnosis and
Yes.
not knowing. So another question is, where is the closest residential mental health treatment center that Washington youth can go to?
that's the name of this presentation. Washington State is at the bottom, I think 38, 48 in the nation as far as mental health facilities for youth. Where our parents go, I am so glad that we have had a couple of them closed. Where we tell our parents to go, even if they're calling 911, is just stand there and stomp your feet and say, I want them to go to Mary Bridge in Tacoma. It's further, but it has a child psychiatric unit. The other one is Harborview. And then for men, we have the one that's Navos, that's south of Seattle. And for females, there's Visions up in Bellingham. The Visions and the Navos are mental, take Medicaid and all. So those are the places we recommend. Um, it really makes a difference if, like I said, I'm so glad we've had some get closed. They just were exacerbating our youth.
Mhm. Okay, thank you. Another question is, in your life, what has made you so passionate about this subject matter? Can you tell us why you're so passionate about mental illness and treatment?
I knew that was gonna come up. I met my husband when we were in seventh grade at church. We went to different high schools and different colleges, but we were together every vacation. And we got married. I went to college straight through and graduated in 3.5 years. And so we could get married. We got married Christmas Eve, and I moved up to Nashville, Tennessee, because that's where he was completing his final semester at Vanderbilt. And he had mental health issues, depression his whole life, and I went with him for 40 years to therapists. And the move here to Washington to be with our daughter, his company was bought out in Dallas, and he'd been a successful executive. And so he had reached what they call an energized state of despair. He was doing better on antidepressants. And then decided that all his life he was taking care of me. And we had the baby. Our grandson was then 5. And he left me a note, and, said he couldn't leave Brennan for me to take care of by myself. So he shot and killed Brennan and then shot and killed himself at the police station in Monroe. I don't ever want anyone else to lose a child because they could not get, mental health care that they need. It's it was the hardest thing in my life, but I went to grief groups and had private therapy for 3.5 years, but the most wonderful man in the world. And after 3.5 years, I have remarried, but there'll never be another person like my Brian.
Thank you, Carolyn.
Mhm.
I'm wondering, we have another 15 minutes or so, and I'm wondering if anyone in the audience has any questions for Carolyn. And go ahead and speak up.
So someone has a question in the chat that says, what do you think would be the best referral for children from birth to age 5?
ECAP is doing a really good job, but they also need to look into play therapy. But we have had parents of younger ones in our class, and then they've gotten their children in ECAP, and but then have gotten them enrolled in play therapy also. But ECAP addresses the needs of the children quite well.
Thank you. Have any more questions?
If you have any question for Carolyn, feel free to unmute yourself or type in the chat. If we don't have any questions, Sue, you had a story. Would you like to share that still?
Sure. So, I'm a public health nurse and I worked with kids my whole career, and I proudly had 2 children myself. And it was kind of like that, thing of the plan to go to Italy. And at a certain point, I found that I was not going to Italy at all. And, like Carolyn said, you would previously have play dates with other children. You would talk to other parents about what your children were doing. You'd share that specialness of having your children be the same age and grow up together. But all of a sudden things started going really bad, and I could not talk to anyone. There was nobody that I could share with because my child was doing horrible. She was doing things like trying to jump out of a moving vehicle or punching me. There was a lot going on at school. She was a tough age, about 14. Puberty, yeah. So I turned to NAMI because I didn't know where else to turn. We had a psychologist who really wasn't that effective at the time. But by turning to NAMI and taking the basics class, I felt hope, and I felt understood. And then I didn't feel so alone because I realized there are other people that had the same situation. And then also I began to feel empowered. And one of the things that I ended up doing was realizing that the level of care she was getting was inadequate. And so I arranged to, as a family, kind of do an intervention and bring her to a residential treatment facility in Oregon, because like we said, you can't force a child to get treatment in Washington. So we were going to one in Oregon, and now that one's not in business anymore, but that helped. And then she came home, and then things got bad again. And so this time she said, if you take me back there, I'll beat you up. And so I got secure transport and we got her there safely. And it took some years, but things with with a different therapist and with A lot of love, never giving up hope, and having support and feeling understood. Love prevailed and we got through it. So I'm really proud to say that she graduated from high school. She's working a full-time job with benefits. She's has goals, hasn't gotten any further education yet, but she has goals. And it's a whole different trajectory than what we were on. So I feel really grateful for the people in our lives, like the psychologist, like the psychiatrist, like NAMI, like Carolyn. It made a huge difference to us and our family. And there's nothing like feeling completely alone. And then there's nothing like feeling like you are understood, and it makes a huge difference. So thank you.
I was glad to retouch base with you. To see
Yeah,
how she was
exactly.
doing.
Yeah, exactly. Thank you. Here's Carolyn's contact information.
Yes. Please feel free to contact me. I go with my parents to IEP meetings all the time. And everyone says, what do you mean your parents? But I consider everyone. I take phone calls at, well, I think the earliest we've ever had one was 2 a.m. But um, at home, and there are my numbers, and I can refer them to some of the places that, if they have private insurance or if they have Medicaid or whatever. We are revising the whole mental health system with Sue and the health department joining our mental health services. I am on the county chemical dependency mental health board of the county, and have been since I arrived in Washington. And we are trying some new things, and so it's going to be interesting to see what we can put together. Also, it's the housing. These kiddos that are living out of cars, that are living in the woods. We have a McKinney-Vento bill that will educate them, will pick them up and take them to the schools. They don't need to suffer and get worse if the parents are on drugs and no building to call home. We had parents that were living out of their cars several times, and then we've gotten them help into some other housing. So it's I don't want ever to have another child die, and so
Mhm.
that's what we need to do.
Carolyn is a force to be reckoned with. So you can contact her and she'll help have resources and suggestions and so forth. So if there aren't further questions, or do we have any more questions? No? Okay. Well, thank you all for coming.
Thank you.
And appreciate Carolyn so much.
Please, if you want to be a basics teacher, call me, and our support group will be the first Tuesday of the month. And the flyer was in the PowerPoint.
Thank you. This was wonderful.
Thank you.